Welcome to the Orange County Forum, where newsmakers keep you informed about local, national, and global issues that impact Orange County today.
Well, thank you for having me here. This is a really, obviously, as a couple people have said, extremely relevant topic right now. Not only did the public exchanges created by Obamacare open a couple days ago, but they did so in an environment in Washington which, as all of you know, the entire Obamacare Act was under intense pressure in the House of Representatives and continues to be a political football as we speak. So I thought for that reason, and for other reasons, it would be good to start with a political question about Obamacare, otherwise known as the Affordable Care Act. And the question which I would like to ask both of you, Dr. Hyatt and Dr. Afable, is Obamacare, in your view, a large-scale intrusion of the federal government, or in the fact that it actually doesn't require things specifically, but more or less provides incentives and disincentives? Is it not so much of an intrusion?
Yeah, so
doctors don't care about
the
Affordable
short
Care
answer
Act.
to your question is neither. First of all, Kaiser Permanente has been a long advocate and supporter of access to health care and access to high-quality health care and coverage for all for many, many decades. And we support the Affordable Care Act. Many of you may know that Kaiser Permanente as an integrated healthcare system was in many ways used as a model for a lot of the legislation that was passed 3.5 years ago. Access to ongoing preventive care, ongoing care if you have chronic diseases, is essential not only for individuals and for families, but for the health of America. It's really a survival issue in America. And we're hopeful that while it may not be perfect day one, and there will be challenges and growing pains, which has happened before when Medicare was started, when DRGs were started for hospital payment. Things don't always go smoothly, that in the long run it is going to help bring health care to individuals and families who have had none. And the important thing in response to your question, Bernard, is the status quo is just not acceptable. You know, keeping things the way they are is not acceptable. And the ACA, the Accountable Care Act, is designed to address these many problems. And hopefully it's getting us closer and closer to a solution that is good for this country. You know, millions of people uninsured, including 5 million in California, 580,000 in Orange County alone. Millions of underinsured. All of you, if not personally, you have friends who are this close to losing their job, having difficulty getting insured, have pre-existing conditions. All of these issues affect people in this country, and that's just not acceptable. The risk of losing health insurance, the highest cost health care in the world, and yet not getting the return on that investment. So the facts are, rather than this government intrusion versus totally free enterprise, if you have health insurance, generally through your employer, through Medicare, through Medicaid, Medi-Cal in California, through the federal government, through the VA, you've got health insurance. The biggest challenge is all those people who don't.
Okay. Let's stop there so we have
Sure.
time for more questions, and let's go to Dr. Afable for your response.
Most everything that Joel said is certainly on target and very consistent with thoughts and feelings that I would have in the organizations that I work with and interact with on a regular basis. You asked a political question, and then there's more to that political question than just the politics. But there is little doubt that there's some constitutionality questions about the Affordable Care Act. There's little doubt of that, right? It goes to many elements of our Constitution. And that's fine, and that's where a lot of the questions have arisen as it relates to how can and should a governmental program or the government itself intrude, and you use that word, intrude in the lives of private citizens in a free democracy such as the United States of America? And that is a hard and difficult question. And I think there are generational changes and generational and time-related answers to the questions of constitutionality. That's all well and good, but there's no question that access for all, as it relates to rights of living, like health care, education, and the right and all the things the Constitution provides for us should be there. It raises a second question, and maybe something we'll get into a little bit, is what does denial of access mean relative to where we've been and where we're going, and what the Affordable Care Act changes as it relates to that? Again, without giving any particular personal feelings on whether this will work and how it works and those sorts of things. If it improves access for all in a just way, and if it does, then I think that most reasonable persons would say that that's a good thing. A lot of that is going to be in how it actually is implemented and how it comes to pass for us as a citizenship here in the U.S. But that being said, access for all is something that every U.S. citizen is deserving of, and every person living in this land is deserving of.
You know, Peter Lee has said this to me directly, the director of Covered California, that the philosophical underpinning of Obamacare is that they want to change societal attitudes towards healthcare so that healthcare is viewed by Americans as a right and a responsibility, and not as a privilege and an economic commodity. What are the chances of that kind of sea change in majority thinking in the United States taking place? Let's start with Dr. Afable.
Yeah, so that does allude to some of the elements that I was referring to,
Yes,
which
it
is health care a right, yes or no? There are constitutional lawyers that will debate that, right? They'll debate whether access to health care is a right or not, right? So, and again, without getting into that particular element, let's say for fact that a right to and access to health services, if they exist for the common good of a society, should be evenly distributed to all members of that society. If we can say that, then that would say that that's appropriate. Now, one has to ask the question relative to the United States. If you think about the United States relative to other countries in the world, in the absence of the Affordable Care Act, do we have an access problem relative to the rest of the world? There are many places in this world that lack of access means that you suffer the consequences in a very significant and severe way. Interpreting that even to the point of demise. Interpreting that in the U.S. perspective is difficult. It's very difficult, because one could say that if you are on U.S. soil, you don't lack access. You don't lack access, because we don't let people on our soil suffer demise because of an inability to pay, etc. Now, again, interpretation of that can be difficult. However, that being said, it's the even-handedness of what that access means and the nature of that access that I think activities like the Affordable Care Act, Medicare in 65, Medicaid in 66, other elements that have come to pass since that time are talking about the even-handedness of that access.
Okay.
And so that makes a difference.
Let's go to Dr. Hyatt on that.
As I was saying before, we are the only major industrialized country in the world that doesn't provide health insurance or health coverage for its citizens. And it is a disgrace, honestly, to have 50 million, 46 million, you name the millions of people who are uninsured, and to have so much uncertainty and fear about what if I lose my health insurance, etc. I can't imagine anything more vital to American families, to American business, than to know that they are not going to lose health coverage for fear of losing their job, and access to care that helps individuals and families live healthier lives. And there's a business side to this, and I know a lot of you are, in the business world. We're not just talking about health coverage. We're talking about a productive workforce, because a healthier workforce is more productive. It helps the bottom line. If your workforce is sick, if they don't have access, if they're suffering and can't get the care that is going to help them, they're not going to be the best workers or the most productive workers that is going to help you or this country thrive in the 21st century.
As medical providers, as heads of large medical systems who are looking at cuts in Medicare specifically, how do you view the sort of fundamental trade-off that underlies Obamacare, that in exchange for taking a financial sacrifice now, you will be compensated by essentially larger volume of business, more customers, more patients? And will that pay off for you?
I think that there are a lot of moving parts in the Accountable Care Act that really all are going to contribute to lower costs. Because we're wasting money now with a very inefficient, fragmented healthcare system. So we're going to save money through the investments in preventive care. And preventive care services, as many of you know, are covered. Number one, they have to be covered. And two, preventive care services are without out-of-pocket cost sharing or co-pays. So, an apple a day keeps the doctor away, right? Secondly, the old system, built on fee-for-service medicine, is very costly. It leads to more services that are, in many cases, not necessary. So I think, all of those things working together are going to help keep costs down, not just the financial pain that you described, that has been, spoken of so much.
Yeah.
Once we decided that this was, as a country, that we were going to go forward with this, once we decided, or it was decided for us, depending upon a point of view, that we were going to go forward with this, the major stakeholders of healthcare delivery went all in. We went all in. So the hospitals went all in and donated, if you will, $180 billion to this effort. The device industry donated through the acceptance of a tax. The insurance companies accepted, went in with tax, etc. What that did is it created an environment where we all the stakeholders in the delivery of healthcare recognize that we are now in a time of a new normal. So this is a new normal. A new normal is one in which we are contributing to the greater good, if you will, of healthcare for the country in the ways that Dr. Hyatt mentioned. And so that new normal is what we're all planning for and adapting to right now. We do know that we have to work with others in order to make this thing work. Mm-hmm. We do know that many of the results of financial sustainability will be based upon some variables that were not in place as recent as 3 years ago, like partnering with others that we generally would not have considered in a partnership mode previously. Mm-hmm. And we're going to have to do new and different things in the future.
Okay. Did you want to add anything to that?
No,
or did you want to answer the question of whether Kaiser will be better off or worse off financially?
I think Kaiser is very well positioned.
Is Kaiser actually the end goal of Obamacare, or the Kaiser model?
I think to the extent that the Accountable Care Act is promoting a lot of the integration and new relationship building, Kaiser Permanente is the model, is one of the models of what the Accountable Care Act is all about. Getting people, providers, hospitals, health plans, patients, working together to improve health and to have aligned incentives where that is the outcome, not profit.
There's criticism in some quarters that the ongoing integration of physician networks and their affiliations with hospitals and hospital systems could create, and the Attorney General's office in California is actually looking into this, an antitrust kind of environment where hospitals that were successful and had, for lack of a better word, cornered the market on physicians groups, or at least, had a lot more physicians groups than other hospitals, could have the kind of bargaining clout that would allow them to raise prices vis-a-vis insurance companies and therefore raise premiums, undermining the word affordable in the Affordable Care Act.
In a time long ago, St. Joseph Health and Hoag would have come together and formed an affiliation mostly to try to reduce costs and to improve our contracting with payers to get better rates. Those days are gone. Now, yes, we can improve some costs, that's for sure. We always have to do that. But the days of organizations, doctors, and hospitals working corporately together for purposes of trying to increase the cost of health care or to increase their payment, those days are gone. The reason those days are gone is because in the court of public opinion, that action will never be accepted. That action will never be accepted. Whereas in the old days, which was 4 or 5 years ago, employers would just take it. Right? So if the cost went up, if you wanted to have access to Hoag, you had to pay for it. Right? And so those days are gone. And so the reason that Hoag and St. Joseph Health came together was for purposes of improving systems of care and to bring two high-quality organizations together where 1 + 1 is 3 on behalf of the community.
Dr. Hyatt, did you want to respond to this question?
Basically, I agree. I think that I don't know exactly what the Attorney General is looking at, but this is a new normal. And I think the real question is, are patients and members going to be better off, have better access, have better quality as a result of mergers, acquisitions, consolidations, whatever? And I think Dr. Afable is correct. I think the days of playing the games of the gaming of rates and this and that are going to be history.
Do you anticipate, let's start with Dr. Hyatt, that, I guess it gets to the question of how successful Obamacare will be in enrolling people, I guess, but do you subscribe to this idea that there will be a significant reduction in emergency room care that will be a big component of reducing costs of healthcare?
Well, it is going to be one of the major components. Emergency room care is expensive care. It's certainly not primary care. And I think a lot of the focus of the Accountable Care Act is to get people established with a primary care physician, with patient-centered medical homes, with accountable care organizations, where they don't have to go to emergency rooms. They can get care that they need through primary care or through other means. Emergency rooms should be there, and it will always be there for emergency care.
Okay. Dr. Afable?
The Affordable Care Act, Obamacare, is designed to reduce the financial barriers to care. Right? That's what it's designed to do. The Affordable Care Act is doing that primarily, reducing the financial barriers to care. What it doesn't do anywhere near as well as that is to improve the access to care itself, the care itself. So if you look at Affordable Care Act, it gets the affordable part as a focus and does some work there, but it doesn't do anywhere near enough for care. And so while I believe that everything that Joel said is important, I'm a bit less optimistic, or I am not as optimistic that the access will actually improve as well as we would like, because the Affordable Care Act does a lot to reduce the barriers financially, but it doesn't incent the providers of care to a sufficient degree to do all the things that Dr. Hyatt just mentioned. It will over time, and I believe it. I'm hopeful that it will over time, and I believe it will over time. But I can see it for the next 2-3 years, where what we're going to be seeing in our emergency rooms is not less people, but more people. And the one big difference that we're going to see in our emergency rooms is that they're going to have insurance cards as opposed to have no insurance card.
Insurance cards with no access.
Well, they're going to have access to the emergency rooms because that's their point of access.
Right.
The means by which they come into a system of care has not been worked through to the degree that it's going to need to be for all of this to work. So from our organization standpoint, we believe we're going to see an increase for some period of time. And the increase will happen because people who are afraid to go to emergency rooms because they don't want to incur the debt, now that they have an insurance card, will be more likely to go.
Okay.
Primary care is at a considerable shortage. And primary care, not just from the physician side, but as a function. So primary care is a function. It's not a specialty of a doctor. And so primary care needs to be developed and will be developed over time, especially for the business incentives that the Affordable Care Act can create. But
Okay.
January 1 of 2014, we do not have the primary care network necessary in Orange County in order to take up the 200,000 or 300,000 people who are likely to have insurance cards come January 1 that do not have one today.
Right. Okay. Let's move on to another question. I know this is one of your favorite questions, so I'll start with you. Consolidation, integrated care, financial challenges, large physician networks. What does the hospital of the future look like 10 years from now, 20 years from now?
Your question relates, I believe, mostly to what happens and what is the future for hospital organizations, many of which have made decisions, like Hoag and like the St. Joseph Health facilities, have made the decision to move from exclusively care of the sick, to care of the sick and in getting involved in the health and wellness, well-being of the communities and the people that we serve. And so hospital organizations have made that switch. In fact, we made that switch and made that move, not a long time before the Affordable Care Act, but certainly prior to the concepts of the Affordable Care Act. And so our organizations are developing new skills, new capacity, new capabilities, new relationships with many others to be very much involved with the full spectrum of care, the full continuum of care, which means physician partnerships in a very profound and meaningful way, which means relationships with other providers of care, long-term care, skilled nursing facilities, home care. It means new information systems that don't just manage 4 days in the hospital, but allow us to manage the information that is throughout the spectrum of the care of a given person's need, whether it be a short time or even lifelong.
Dr. Hyatt?
So we're already there. As an integrated healthcare system and an integrated hospital system,
You are the hospital of
we own the
the
hospitals,
future?
we own the pharmacies, we have the physician groups, et cetera. But, I mean, to your point about the hospital of the future, I think Dr. Afable is describing what has to evolve in sort of the old model of hospital organizations. There's a lot of pressure to keep people healthy out of the hospital. There's a lot of pressure to do what's necessary to keep people from being readmitted to the hospital. So in many ways, the hospital becomes the loser in the game unless they find another business model. And so I think that helps to explain a lot of the mergers, acquisitions, alignments with primary care, et cetera. The hospital of the future, though, is going to become much more efficient. It's going to become a place where the sickest of the sick are, because there are going to be many, many other alternatives to taking care of people that we traditionally have thought of as being as needing hospital care. There's going to be more home care with home assistance and home care. There's going to be shorter stays. Everybody here is familiar with the use of ambulatory surgery. Surgeries, gallbladder removals, gallstone removals that used to be, require 5 to 10 days in the hospital are done as an outpatient. There's going to be more and more of that. So a lot more intensive care is going to be happening out of the 4 walls of the hospital.
Okay.
There's also going to be new relationships with providers through telemedicine, through the telephone, through remote monitoring. All of this is in the works, and it's a great opportunity for investment and development.
Where does Kaiser stand with the move towards paperless healthcare? Progress report in 10 seconds. Do you have any concerns yourself about privacy? And do you think it's all it's cracked up to be in terms of efficiency?
Well, Kaiser Permanente, in case nobody has heard, is already there. What's difficult in the community, which is adopting more and more electronic medical records, is that even in the hospital system, different hospitals may have different electronic medical records. Different physician offices have different electronic medical records, and they don't necessarily speak or connect to each other. So that connectivity still has to occur. You know, as far as your question about privacy and protections, I mean, that's at the foremost of our minds.
Okay. Dr. Fadley?
Not only will it be more secure, and can the privacy be maintained, and is anything perfect? No, it's not, but it's better than what we have without digitalization. But more importantly is the use of the data. So the data, which is what medical records are. Medical records are sources of data. They are places of data, data for the good of the care of people. And our ability to use that data, to communicate the data, to take the data and put it into algorithms or put it into forms in which it can improve the care are vastly improved when we can create uniformity and the ability to move information electronically. And as we get accustomed to doing so, just like the banking industry, just like the air travel industry, just like telecommunications, once we see the value of the digitalization of data, this will no longer be a discussion.
And if I could just add one other thing, our members have access to their own records online. They can see information about their past medical visits, look at their medication records, see if the immunization record is correct, etc. So, you know, patients can double check and actually send me emails. I'm a family physician. Dr. Hyatt, you got this wrong. You know, so, you know, it's not invisible to the patient anymore. Whereas, again, with those old, dirty, thick paper records, you know, you never knew what the doctor was really putting in the medical record.
But by the way, there's a day coming very soon when the doctors at Kaiser are going to be complaining and wishing they had a data system as good as Covenant Health Network. That's coming up very soon. I just wanted to put you on notice. So.
I'll let you two talk about that afterwards. You can take it outside. Okay. Okay, I guess we're finished.
The Orange County Forum is brought to you through the generous support of the Orange County Register and our sustaining partners. For more information about the Orange County Forum, call 949-588-9884. The Orange County Forum is a nonprofit organization. Your contributions are tax deductible.